Done from 4/12/2023 through 4/26/2023. The contest was created and administered by bestofIndianaCounty.com. GCES did not pay bestofIndianaCounty.com or participate in the creation of the contest or results tabulation of the voting.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Good morning to you, and thanks for being with us. Our conversation with Sara George is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Sara is a cardiology nurse at the Indiana Regional Medical Center, and here we are in Heart Month. We're going to learn what it is that she does. If you look at her badge, it says Stroke STEMI Coordinator. Sara, good morning. It's good to talk with you this morning. Tell me what that means. What is STEMI?
STEMI is an ST elevation myocardial infarction. So in layman's terms, I say heart attack coordinator.
Okay.
So that's the definition, the medical definition of a heart attack.
So what it is it that you do as the coordinator?
So as the coordinator, I make sure that we meet all of the national standards and guidelines for the programs. So for the stroke, where's Primary Stroke Center, for our STEMI program, and as a chest pain center. So for all those programs, I make sure that we're meeting those national standards, continuum of care, and are aligned the whole way across.
Those entail an awful lot of work, because I know that those standards are very, very high, and IRMC doesn't just strive to meet them, you strive to do better than them.
Yes.
Yeah. So let's talk about how we do this. First of all, stroke. Stroke is a very important element of heart health and heart care, and it's very, very prevalent in our society today. And we'd like for it not to be. Right. So that's what you work on
yes.
as in that position.
Yes, a lot of both of the programs sort of intertwine with the standards and, the medications that we want to make sure the patients are on. And I was actually reading an article from the American Heart Association. Stroke is the 5th leading cause of death in the United States, and heart disease is the number 1 leading cause. But less than 50% of Americans know that heart disease is the leading cause of death.
Yeah.
So that's pretty,
eye-opening. It should be.
Yes.
It should be for folks.
So here to educate.
So when we're thinking about stroke, and we're thinking about folks who suffer from stroke, as we've heard quite often, there's more than one kind of stroke, and the treatment protocol for those two kinds of stroke are different.
Yes.
Yeah.
So there's a hemorrhagic stroke, which is bleeding into the brain, and then there's what we call an ischemic stroke, which is a clot in the brain blocking off that blood flow. In the treatment for both, we want to either stop the bleed or we want to break up that clot, and we are able to do both of those at IRMC.
Yeah. Tell me about determining what kind of stroke somebody is suffering from. How do you do that?
So we take you to what we call a CAT scan, and that's the national gold standard test for ruling out a stroke. And that will tell us automatically if you have any bleeding in the brain. It will also show us if you have a clot in the brain, but sometimes you need further testing, so you may need an MRI.
Yeah. The acronym changes, it seems, every year. But tell me about the acronym. It used to simply be FAST.
Yes, now it's BFAST.
BFAST.
BFAST. So B is for balance, E is for eyes, so if you have any vision changes, blurred vision. F is for face, so if you have any facial droop on one side. A is for arm, if you have any numbness or tingling. Any weakness in one arm, it's usually unilateral, so one side. S is for speech, so if you have someone that's having difficulty getting their words out, difficulty understanding, if they have slurred speech. And then T is for time, that time to call 911 if you're having any of those symptoms or anyone around you is having those symptoms.
Yeah. All right. Let's then pull into this conversation heart attack.
Yes.
Myocardial infarction.
Yes.
And learn about that as well. As you said, some of the symptoms are the same.
Yes. So, for a heart attack, we use the word chest discomfort because a lot of people describe their chest discomfort whenever they're having a heart attack differently. So you can have chest discomfort, chest pressure, chest tightness, squeezing, fullness, or pain, and that pain usually lasts more than a couple of minutes. It can go away and come back. But then some people have, shortness of breath, nausea, lightheadedness, dizziness. And some of those signs are usually common in women more than men.
Oh, yeah. Yeah. And there are some heart attack symptoms that don't even involve the chest right away.
Right.
Yeah.
Like I said, so like if you're nauseous, vomiting, maybe you're sweating a lot, maybe you just feel lightheaded. Yeah, you can be having a heart attack and not initially have any chest pain at all.
In either case, you're going to the ER right away, aren't you?
Yes, you are. You should be calling 911 immediately.
Yeah. And you just said something very important. Call 911 immediately. Should we hop in our car and drive really fast to the ER?
No,
or should we call 911?
We should be calling 911 for many reasons. You have to think about those people around you that are on the road. What if something happens to you behind the wheel and you're putting someone else at risk? But number one, our first responders, our local EMS team at Citizens Ambulance, they have the training and the knowledge to be able to take care of you and initiate protocols before you even get to the hospital. And
they also have the ability to communicate with the hospital, and
yes.
That's really important.
Yes. So we can know that you're having stroke symptoms and coming to the emergency room. We can prep for that before you get there. Same with a heart attack. They can call us and say, we think that this person's having a heart attack, and we can prep and get ready for you before you even arrive.
Yeah. We're talking with Sara George this morning about heart attack and related conditions and what you should do if you feel that that is something that you may be suffering from. And Sara, we're not supposed to diagnose these things ourselves. We're supposed to let you do it, right?
Correct.
Yeah. Get to the ER and let them take care of it. So say you are having a heart attack and you get to the ER. What happens then? Because this is where we begin to think about going upstairs for the interventional cardiology.
Yes. So we have we follow evidence-based practice, national standards. We have protocols in place. You're going to come in. We're going to take an EKG, which is a picture of your heart rate and rhythm, and that's an identifier to see that you're having a heart attack. We're also going to do some blood work, and we're going to give you some medication. We're going to expedite getting you up there to the cath lab so that we can figure out what's going on in that heart.
And the team will get right to work on you.
Yes, very fast. Everything happens very fast.
Yeah. Now, when you have that catheterization and they're taking a look at your heart, and they're identifying if you have a blockage and if they can do something with it there or if something else needs to be done, say you get the result generally is going to be a stent, we're hoping. And tell me about the recovery time from getting that stent.
So we actually have a cardiac rehab after, if you do require intervention, like a stent, like you said, you're going to be staying in the hospital for at least 24 hours. And whenever you're discharged, we have cardiac rehab and you'll be following up with them. What that entails is just making sure that your heart is getting back to the muscle that it needs to be.
Trying to determine the damage to it.
Yes.
And then devising a plan to go forward, and that's where the cardiac rehab comes in.
Yes.
Yeah. There are wonderful folks working in the cardiology department at IRMC that are going to lead you right through the process. And they involve various different medical offices, and really it's a lifetime of care, isn't it?
It really is. And, we last year became Chest Pain Center accredited, and that makes sure that we follow that entire continuum from outpatient follow-ups to outpatient testing to rehab. You can do that all at IRMC.
Yeah, that's pretty amazing, isn't it?
Yes.
You think about the development of this program, which began probably really with real seriousness about 10 or 15 years ago was when the interventional cardiology program began there at IRMC. Just took a step forward in the care protocol, and it's really amazing. So tell me about you and why it is that you chose to pursue this particular field.
Todd, you're hitting me with a hard question there. I specifically like stroke, and with that, I was also asked to be the heart attack coordinator, so that came hand in hand. But I am very intrigued in the brain and what it does, and also the heart. I mean, they go hand in hand. And just seeing those patients be able to recover from such devastating factors is very amazing.
Yeah, I tell you what, when you see folks coming into and out of that rehab who might have been in a very desperate situation only a couple of weeks before, it really is an amazing thing how quickly your life can turn around. It's a whole different way of living, but it's life, and it's not stuck in a chair somewhere waiting for the end to come. It's right back to active living, and probably more active than before.
Right. You know, you hear that you're having a heart attack, you get scared, intimidated that you could possibly go into cardiac arrest and die. And we go to the cath lab and we essentially save your life and, like you said, rehabilitate you in rehab and get you those outpatient follow-ups and follow you basically for the rest of your life to make sure that you're taking your medications and doing everything that you need to be doing. Yeah.
It's a very rewarding place to be, isn't it?
Yes, very much so.
Well, it's wonderful of you to come in and describe it for us today. We appreciate that so much. Now, folks want to learn more about IRMC Cardiology. I know that it's very comprehensively covered on the website. Are there other resources?
Of course, there are other resources. We actually just, you can, I would say, look on the website, number one, but we do have a community outreach. We just did a pop Pilates class with one of our cardiologists. She actually taught that for the community and talked to them about heart disease.
Dr. Linton Frazier?
Yes. So we just do fun things like that.
Yeah, there you go. There are always great events and programs going on to explain the programs that are available to you at IRMC. Meanwhile, we need to keep on top of this, and any symptoms that we develop, we need to get taken care of, and probably at a certain age or a certain physical state of well-being, we need to be sure we're making regular doctor's visits, right?
Yes. You should definitely be following up with a primary physician on a regular basis.
Very good. Sarah, thank you so much for the visit.
Thank you, Todd.
We appreciate that. It is the voice of Indiana County. It's WCCS 101.1 FM. AM 1160 and WCCSradio.com. We took it right up to the marker here. 8:25 in the morning. Jake is in the newsroom. He's on the way right now. Boomer has the CBS Sports.
This is Boomer Esiason with the CBS Sports Minute. Legendary NFL columnist Peter King is retiring. I knew him at the start of his illustrious career.